Hi there, young man. What about a ceiling for these people that are in nursing homes?
What about a what?
A ceiling. What is your ceiling per year? Like a person in the nursing home, you use up that ceiling, what do they do? Really out the door?
No, I think you're talking about are you talking about the president's plan? He puts a global budget on Medicare.
No, I'm talking about your plan.
We don't have a ceiling.
I didn't really understood it.
Yeah, I'm not, a ceiling, I'm not sure.
You have a limited block grant.
Oh, you're talking about Medicaid. Okay, I thought you were talking about Medicare. So Medicaid, yeah, sure, okay. Medicaid. Medicaid is, many people don't know how Medicaid works. Medicaid is a program that is jointly financed between the state and federal governments. It's run by state governments. The federal government, through a funding formula, funds its share, usually a majority of it. The problem that we have experienced with Medicaid, we have dozens of letters from dozens of governors saying their hands are tied and they're unable to reform Medicaid to meet the needs of their particular populations in their states. We treat every state the exact same, whether it's New York, or New Jersey, or Wisconsin, or Colorado. And so what we're proposing is to take that federal money, keep growing it at inflation, and send it back to the states, and give the states the ability to customize Medicaid to meet the needs of their particular state populations. The one catch is, they can't use that money for other purposes. It's got to go to the Medicaid population. It's got to go to your nursing home population. It's got to go to your low-income health population. It is, I think the problem we have with Medicaid is it's going bankrupt. Doctors, in Wisconsin, this is so true, doctors are seeing less and less Medicaid patients. It's a system that people qualify for, but a lot of people don't even get the benefit because physicians won't even take them. So we got to reform this program. And we also need to recognize that not every state is the same. So let's give the states the ability to customize Medicaid as they think they need to fix their problems in their states. They already run the program. They just get some of their funding from the federal government. We're saying send the funding from the federal government to the states, but give the states the ability. That's what block grants do. Give the states the ability to customize it to their state's needs.
How solvent will that fund be?
How solvent is it?
How solvent will it be when we run into the problem?
Well, Medicaid is growing. It doesn't. Its solvency isn't measured like Medicare and Social Security. So there isn't like a trust fund for Medicaid where you can measure whether it's in deficit or surplus. Medicaid doesn't work like that. It's because it's bifurcated through state and federal financing. It does extend the solvency of Medicaid, but the whole point of Medicaid is you can't say when it goes bankrupt. I can tell you when Medicare and Social Security go bankrupt. That's a date we know. That's a date the federal government has. We don't have that with Medicaid. All Medicaid ends up doing is it just keeps squeezing down prices to providers and making it a smaller benefit, and more providers don't even take Medicaid patients. So the way the Medicaid program is working today is it's not working to serve low-income people. So what we're saying is let the states have more freedom in taking their money and customizing it to meet the needs of their low-income population. Yeah.
Okay, so you're going to give everybody in your plan a voucher. Yeah, wait a
It's
minute.
actually not a voucher, but what you're talking about, the 54 and below for Medicare, is that what you're talking about?
Yes, you're giving people a voucher so they can get their insurance. Or what, right now I get through Social Security and Medicare. And then, if you're going to privatize it, because you have to go to the insurance companies, how are you going to guarantee people can get insurance if they have a pre-existing condition?
No, it's a very good question. If that's the definition of privatization, then it's already privatized. Just so you know, Medicare already operates through private companies. Medicare prescription drug benefit is already delivered to current seniors through private companies. Medicare Advantage, which about 24% of Medicare beneficiaries have, is already through private companies.
Negotiated by the government.
Yeah, the government.
Not individual people.
No, hey, sir, it doesn't work. Heckling doesn't work, okay? If you want to ask a question, raise your hand. So, yeah, I technically call that a heckle. All right, so, it's just, I'm trying to talk to this lady and answer a question. Because it's a very good question. First of all, a voucher is, the money goes to you, and then you take it and you go buy insurance. That's not what this program is. That's not what federal workers have. Medicare has a list of comprehensive plans that they regulate that cannot turn people down. It's guaranteed issue, meaning regardless of your condition, you can't be turned down, you get the insurance. So the insurance companies under this proposal can't cherry pick, they can't turn you down, they gotta take whoever signs up. And what we do is when you pick your plan, just like Medicare Advantage, just like the prescription drug benefit, Medicare subsidizes the plan. It doesn't give you the money like a voucher, it subsidizes the plan. The point we're making is, given that this program is going insolvent, given that there's no way the government literally can come up with the $31 trillion it doesn't have to keep this going, give more money to low-income people, more money to people who are sicker, and less money to wealthy people. That is how we propose to subsidize Medicare in the future for people who are 54 and below. That, according to the trustees and the actuaries, makes the program solvent. So yes, you have to, especially for the senior population, you have to make sure that they can't be denied, that they have a, just like the federal employees right now. Anybody who's a federal employee, regardless of their health condition, can pick whatever plan that is being offered to them, and then the federal government subsidizes a portion of their plan. The only difference we're talking about is subsidize it based on a person's need. And what we're proposing specifically is when this starts, not until 2022, 2022, is the subsidy equals the average per spending on current Medicare beneficiaries at that time. It grows and it adjusts, like I said, more for low income and middle income, more for sick, less for the wealthy. That's how we propose to do it.
So, an older person happens to live a little longer, are they going to just be out on the street?
And as they get sicker, they get an even bigger subsidy to protect them for their premiums. It's just like the current system would work for Medicare Advantage, or it works for the drug benefit. Let me go over here. How about over in the corner?
Just a question that I'm not hearing anyone address. What about the $60 billion annually in fraud, just for Medicare alone? And taking Wisconsin specifically. So we have, I don't know the exact figures off the top of my head.
No,
but
it's a real good question.
It's upwards of a couple $2 billion annually in the state of Wisconsin. And we have 4 to 6 people investigating for the entire state.
Yep.
Why not create the jobs, give the individual states the tools they need to work on that fraud?
So Medicaid, that's exactly what that's part of the reason why the block grant proposal is the way it is. Here's the issue with Medicare. I've been on Medicare's oversight committee for 10 years now.
Could you repeat the question?
Oh, what about Medicare fraud? What are you doing to go after Medicare fraud? $60 billion a year. Actually, I've seen even bigger estimates than that. Improper payments. There's
Miscoding.
of all the fraud that is in government, Medicare is the #1. You got, in Florida, you got pizza restaurants, billing Medicare for doing, for doing AIDS drugs. You've got lots of fraud, improper billing, and the problem is this. I have seen demonstration project after demonstration project. I have seen new fraud laws and new fraud laws and new fraud laws go after Medicare. I think it's the structure of Medicare itself. Monopolies don't work. Monopolies, whether it's a corporate monopoly or a government monopoly, is very wasteful, very inefficient, raises prices on consumers. And so when money is wasted in Medicare, there's really no incentive to go after that waste. Medicare just pays the bills. So if somebody sends a bill to Medicare, odds are they're just going to pay the bill. And so you have all of these improper billings that come into Medicare, and there's really no way for Medicare to even know whether or not this is it's accurate or not. Except what we've learned through the prescription drug benefit and others is if you have competing plans, competing against each other for the senior citizen's business, then they really have an incentive to go after fraud. They really have an incentive to make sure that they're not being improperly billed. They really have an incentive to go and check up on who is sending them the bills. Is it really a hospital, a clinic? Is it really a doctor? Did they really do that test or not? You need to have the right incentives to get after all of that fraud. Because the problem inevitably is, because Medicare's spending is going so high, all these improper payments, they just do across-the-board cuts. And so the way Medicare works today is they don't distinguish between a good producer or a bad producer. They reward or pay for a hospital, for a doctor, the same, whether the doctor or hospital is efficient high quality or high cost or not. So let's just say Mercy. I'm not trying to pick on Mercy, but let's just say Mercy is giving you really good care at a really low price. But you go to Aurora and they're giving you really bad care at a really high price. As far as Medicare is concerned, it's indistinguishable. They pay you the same. They don't reward providers for being efficient. They don't reward providers for rooting out fraud. They don't reward providers for getting at high quality, low cost. And so I think the design of the system itself is a part of that problem. And look, if you have the federal government as the only payer, and that's what I think is the flaw of single payer systems, then you'll just have to put a global budget and you'll have to ration care and price control underneath it, indistinguishable to whether a provider is good or bad. I really think at the end of the day, to get at that issue, which is a huge issue, you got to give more power to the patient, more power to the consumer. I would rather have 300 million healthcare consumers in America with real power, and I'm saying change insurance laws so they have power with insurance companies, instead of having a few thousand bureaucrats just paying the bills, hoping that there's no fraud. You want a patient-centered system so that the patient drives quality, drives innovation, drives efficiency, so that the providers of healthcare, whether it's an insurance company, a doctor, or a hospital, we want to know how much they cost, whether they're good or bad, and who's doing it the best way, and we want to reward them with our business. And we want to benefit from doing that, so that they compete against each other for our business. In Medicare, except for in a few areas, Part D aside, Medicare doesn't do that. And I personally think that's the right way to go after all this fraud. Because we've had Medicare fraud for years, we put in task forces and all these things, and we still have it. And I think it's the flaw of the system. I'm sorry for giving you such a long answer, but it's a really important question. Sir, the gentleman who wanted to talk earlier.
Yeah, sorry for the sidebar.
It's all right.
Look, first of all, I want to make a comment about I think it's over 70, 80, 90 years old. They lose, their cognitive abilities diminish. To let them sit there out there in the world trying to negotiate and decipher all these insurance policies and plans, the numbers would make their heads spin.
They do it
will
already?
not be able to do it. Now the government does it for them. But I notice your
Can I just get you right there?
Sure.
About 10 million seniors do it today already, right now, with Medicare Advantage. They get places to choose
And
from.
my mom called me because her head was spinning.
Okay, great. So you're being a good
10
son.
million,
You're helping your mom.
But a lot of people don't have that help. Okay?
Okay.
And maybe their sons and daughters don't have the ability. I notice a lot of your charts have OMB and CBO. You mentioned Congressional Budget Office, OMB,
Yeah.
I think it's Office of Management
Office
Budget.
of Management Budget, right.
Okay. Just want to get that straight. Your deficits are a combination of reduced revenue and spending. We have reduced revenue by cutting taxes. Americans are paying the lowest percentage of their income to taxes since 1950. In fact, the top 400 households pay an effective rate of 16.5%. Most of the rest of them in this room are paying 22.5%. Corporations have a rate of 35%, but an effective rate of 17%. I would agree that I would go down to a lower corporate rate, but if we drop it to 20, they'll pay 12. We drop it to 10, they'll pay 7. We drop it to 5, they'll pay 3. That's a fact. But
No, I want to get it because it's a compelling point.
in fact, many businesses don't pay any taxes. 7 out of 10 businesses don't pay any taxes. Many American families don't pay taxes though too, because even though they work, they don't make enough money and they don't have to pay taxes or they don't have a job.
Right.
That's not true for business. They're doing very well. A line from my last investment newsletter said American businesses are in tremendous financial shape. GE had profits of $14.5 billion, paid no federal taxes, and got a federal refund for $3.5 billion. ExxonMobil, $30.5 billion, no taxes, got a federal refund of $153 million. Every day I read in the newspaper, tax grants, tax credits, special tax districts, and low interest loans to business, including ones.
Hey, I see where you're going. Okay.
Well, let me finish.
No, because I want to get to other people. I knew where you're going.
I know you want to cut me off because you don't want to hear this. Okay?
No, I just want to get other
let me
people.
jump. Okay.
Wrap up fast because I want to respond to you. Then I want to get. There's a lot of people
Let me
who want to
rush through this quick here.
All right, here. Let me get you there. So, you're right. Go figure. I just said that.
I got a whole bunch
GE, no,
more.
I know you do, but
Debt, you mentioned our debt.
I get the thrust.
You voted for our debt.
Let me get at this. I just passed a budget that pays off our debt, by the way.
Well,
So let me just get at this. Now, the corporate tax reform. Look, GE. Oh, thanks. That's very kind of you. GE made all this money and didn't pay taxes. GE has gotten all these loopholes that they can take advantage of in the tax code. What the Fiscal Commission, the President's bipartisan Fiscal Commission, supported by a majority of Democrats, says, and we agree with and put in our budget, is clear the crud on the tax code so you can lower tax rates so we're more internationally competitive. You gotta remember, we're not just competing against Illinois and Iowa. We're competing against India, China, many other countries. We tax our businesses a lot more than our competitors tax theirs. When 95% of the world's consumers are outside of this country, and you got to make things here and sell them there to keep our economy growing, we got to be competitive. Now, take a look at GE. It's a good example. Let's get rid of these tax deductions so we can lower the rates, and so whether it's GE or, I don't know, another company, let's make sure that if they make the same amount of money, they pay the same amount of taxes. Right now, the tax code is Swiss cheese. It is full of so many different little loopholes and deductions put in there by Republicans and Democrats, special interests, so that they can get out of actually paying taxes. So no, don't lower it with the same tax base so they go, like you say, from 25 down to 12 and down. Lower it and get rid of the deductions so they actually pay the actual statutory tax rate. Now, look at individuals. The top 1% get almost all of the tax deductions. First of all, you have to itemize deductions to get a deduction. And mostly it's just the top brackets, the top two income tax brackets who do it. The top 1% get almost all of the tax deductions. That means if you're parking your money in a tax shelter, it's being taxed at 0% tax rate. So what we're saying, along with the Fiscal Commission, is get rid of these tax deductions so you can lower tax rates so that everybody is paying a real tax rate that actually you're putting that money toward a tax rate. So like I'm saying, 25%, that money, which is paying zero tax, is going to be taxed at 25%. The point I'm trying to make is this. You got to remember, our companies are competing internationally. Most small businesses pay their taxes as individuals. The current code is to bring our tax on individuals up to 44.8%. Most of our jobs come from successful small businesses, subchapter S corporations and the like. You raise the tax up to about 45%, throw state on top of that, they're over 50%, you will slow down this economy. You will make it harder for small businesses to become big small businesses. What we want to do is clear out the crud in the tax code, mostly enjoyed by large corporations and wealthier individuals, so we can lower tax rates and get ourselves more economically competitive. And so that at the end of the day, you have a simpler tax system, a fairer tax system, and a flatter tax system, so that the same person making the same amount of money pays the same amount of taxes, regardless of whether they are able to get something in the tax code or not.
Corporate America sending lobbyists to Washington, D.C.
Absolutely.
And you can take them all away, and in 10 years they'll go right back in there. Are you kidding me? That's what the lobbyists do.
We're saying get rid of that stuff.
But they don't come back.
Well,
Just like it got there in the
that
first
doesn't mean
place.
you don't try, does it? Ted, let me go to you.
Oh, you voted to raise the debt. You voted to raise the debt.
There's other people here.
I'm going to let Ted. Go ahead, Ted.
Okay, I want to address somewhat the same question that this gentleman was asking about. But I want to preface it by saying, in all of the expenditures that you talked about, I didn't hear a single mention about the bloated defense.
Sure.
But you have,
Yeah, I don't even know what you're saying, but, sir, if you don't mind.
It's a nice sign, but put it down.
It's a nice sign, but just let's be respectful. I can't even read it from here. It's probably directed towards
It's all the debt you voted for.
Okay, that's
Raising the
fine.
debt limit, that you voted for. The
Thanks.
tax cuts for the rich, 2 wars, Medicare Part D, all deficit spending, bars to China.
I'm sorry, but Ted Kinnaman has the floor right now. And let's be respectful to Ted Kinnaman, okay?
Yeah,
He agrees with you on this
You
stuff,
talked
by the
for,
way.
you talked for half an hour. I
So-
had 5 minutes. Less than 5 minutes.
Ted?
And don't tell me to shut up.
I'm going to have
You're
to
gonna make me shut up.
No, hey, come on. Let's be respectful to one another. If you keep doing this, I'm going to have to ask you to leave so other people can hear. Ted, go ahead.
you have obviously made a big push about the federal deficit. This despite the fact that you voted in favor of the Bush tax cuts, which increased the deficit by $800 billion. Now, I know that you and the Heritage Foundation and people like that have claimed that if we cut the taxes on corporations and private individuals, that that's going to increase economic activity.
That's right.
Okay, I have a chart here. You can't read it from there, but maybe you can see the pictures. Let me say what this shows. These figures are from the Government Bureau of Labor Statistics. Under Jimmy Carter, 2,756,000 jobs were created. Keep in mind that under Jimmy Carter, the tax rate for the corporations and for private individuals was 70%, and they were creating jobs. Reagan Bush came along and lowered taxes, and they created only 1,500,000 jobs. Clinton came along and raised a little bit the upper level income tax, and he created 2,882,000 jobs.
So the key is raise tax
W.
rates.
Bush came along, and you supported all of Bush's tax cuts, and in his entire 8 years, he created 660,000
So,
jobs. Now,
I can do-
How can you complain?
Ted, I can do the same thing with statistics you're doing. I can play with the years.
Yeah, we just saw that.
You know, Bush, I could say, until the economic crisis, he created 5.5 million new jobs. I mean, I can say, you kind of forgot the 82 to 88 period where millions of new jobs were created. So, you know, I think you're missing a few years there where jobs were created. The point I would simply say, Ted, is,
Figures I got from the U.S. Bureau of Labor Statistics.
I had these things committed to memory. I've been doing this for a long time. I would just simply say, Ted, number one, this isn't the 20th century anymore. And we can't go back to the days of taxing ourselves at 50 or 70% tax rates. You will shut down the economy if you do that. You got to remember, Ted, most of our jobs come from businesses that file as individuals. You want to give them a 70%, 50% tax rate when China's at a 25% tax rate? Who do you think is going to win in that exchange? You got to be globally competitive. The other thing is, when tax rates were cut in 2003, revenues did go up. Now, I am not saying that all tax cuts pay for themselves,
That's a lie.
but revenues ended up going up. Now, it went down when we went into a recession. Now, if you take a look at where we are in the history of this country, tax rates have gone from 92% down to 28%. But we still raise about 18.3% of GDP. So we still raise about the same amount of money of GDP. The difference is economic growth. When you have flatter taxes, your economy traditionally grows faster. Now, we've had a lot of problems. Look, the financial crisis, I would not argue, and I don't think you're arguing, was because of the Bush tax cuts. It was because of Fannie and Freddie, the Federal Reserve, Wall Street, and all this other stuff that gave us a financial crisis. But to suggest that the tax rates going from 39.6 down to 35 is what crashed our economy, I don't think that's what you're suggesting. The point I am suggesting, like the Democrats and the President's Fiscal Commission, is that in the 21st century global economy, we got to be competitive. And when we tax our businesses a whole lot more than our foreign competitors tax theirs, we lose, they win. So let's clean up the junk out of the tax code, which is mostly enjoyed by higher income earners and well-connected corporations. Clean that up so we can lower our tax rates and make them more competitive so we can get the economy growing. But at the end of the day, Ted, we're not even talking about lowering tax revenues. We're talking about reforming the tax code. And what I think we need to do to get higher tax revenues is not keep raising our tax rates, because I really fundamentally believe you will slow down our economy if you do that. Let's grow the economy, get people from unemployment back to work, collecting paychecks, paying taxes, and then your revenues go up. And don't forget spending. Look, I know you don't like the Heritage Center for Data Analysis, but I think it's important because CBO doesn't measure economic effects of budget. So we asked some economists to measure it using what they call a Keynesian model, more of a left-of-center model, They think this budget will create nearly a million new jobs next year. Raise wages of 1.1 trillion. Raise economic growth by $1.5 trillion.
Those
So
have been refuted so many times.
they're brand new numbers, so they haven't been
They're
refuted.
not valid.
Well, you know, I just don't agree with that. They're projections. Nobody knows the answer whether they're right or not. But let me go with this. These aren't my numbers. Red is where spending is headed. Green is where revenues are. You can't close that gap with revenues. If you try, you'll shut down our economy. Now, I want to make sure I get shorter. How about the person in your hand? What is that? Oh, I couldn't see. I'm sorry. Oh,
It's Brad.
sorry. I saw a reflection on it.
No, it's cool. I guess that the point I want to make to kind of agree with these gentlemen here is that you showed the federal deficit towards the end of the 90s. You know, we're running a surplus, and I don't know how you can make the argument that the Bush tax cuts, 2001, 2003, did not contribute to the deficit when you clearly see the line heading into the red right there. I don't see it. And then to make
I didn't say they didn't contribute. That revenues increased after the 2003.
Now you're making the argument.
That's absolutely wrong.
No, that's not true. It's not. So
It's absolutely wrong.
okay, hey, look, please, sir.
But
Okay.
now you're making the argument here that, you know, getting rid of the Bush tax cuts isn't going to do anything and it has to be all on spending. You know, the deficit and the debt are a problem. I'll agree with you there. That's something that we have to get under control. But by, you know, focusing solely on spending is a way to do it,
Yeah.
while, you know, hurting, the elderly, education, starving people in the inner city, I just don't think that
Who's starving people in the inner city?
in the country, people starving.
I don't know. Okay, so I get what you're saying. So look,
Yeah.
let me go back to.
Why can't you balance it between? Why can't you balance it? It just seems like a lot of this is falling
No,
on the people that benefit from
It's a
nothing.
fair point. Because A, the problem isn't that people don't pay enough taxes. The problem is that our government is spending way too much money.
But when you
We're, no, just let me, I listen to you. The problem is we're spending money we don't have. And to the extent that we take our eye off the ball, which is spending, and raise taxes, you and I disagree on this, you're going to slow down your economy. If you can't even tax your way out of this problem. If you take all of President Obama's tax increases, raising the top tax rate, raising the taxes to 44.8%, you're going to slow down the economy, and he can't even, his spending goes even beyond that. So even his budget shows you can't tax your way out of this problem. Here's the deal. The best way to fix this problem, obviously it's my opinion, you don't agree with it, is you need to grow the economy. And you don't grow the economy by taxing it more. And you need to cut and control spending. Spending is the culprit. The sooner you get spending under control,
I mean, it's just
and
so
the faster you grow the economy, the better off we are. Yes, sir. No, I don't want to get in an argument because I want to get to other people.
This is
Go ahead.
How do you not want to get into
Sure.
argument?
I think the spending is a major issue. You are looking only at domestic programs.
No, oh,
We have
by the
a
way,
war.
yeah.
We have two, now maybe three wars
Yeah.
that were started unnecessarily, but we have three wars. $1 billion a day, is that accurate? $1 billion a day.
I don't know
Let's
the
just get out of
okay.
wars for one spending thing.
Yeah.
Quit supporting corporate welfare by giving oil companies paying everybody buyout of the American economy. Where is your spending plan going to take in all of the
Yeah, no, that's
federal budget rather than just
Sure.
commercial?
I didn't get to it all. It's a big budget. So back to Ted Kinnaman's point, we cut the Pentagon by $78 billion and take that for deficit reduction. So every agency gets cut in this budget. We cut foreign aid in this. We also budget for the war, which by the way they haven't done in the past, so that we're actually putting it in the budget and not paying for it with what we call emergency supplementals.
Who's they? Who didn't pay for it?
The Bush administration never paid for it in the past. The corporate welfare, the guy left, I don't know, there you are in the back. Totally, amen, brother, I agree with you on this. I didn't get into everything that's in our budget. That's one of the things we proposed, is to go after corporate welfare. Both parties do this. They spend money on corporate welfare. We're talking about agriculture, energy, financial services. We propose to get rid of all of those subsidies. There's not only corporate welfare in the tax code, and we've had a good conversation about that, but there's corporate welfare and spending, and we propose to get rid of all of that kind of corporate welfare. You gotta reform welfare, for people who need it so that it works with 21st century. We're also going to end it for corporations who don't need it. Energy, there's a lot of corporate welfare there. There's a lot of corporate welfare for financial services firms. And there's also a lot of corporate welfare throughout the government. Yes, I think we need to go after that. Let me go over this.
What changes people like me who benefit from Medicaid are going to be seeing with our programs, and how are you going to protect us so that we still are able to get health insurance for ourselves and our children, and even people who aren't parents, who are low income or work at places where insurance isn't available. It's not even offered at my job, even if I was full time.
Now, let me give you two answers. One, I have a bill that's different than this budget, which I really believe the way we subsidize healthcare through our tax code is upside down. People in the top tax bracket get the biggest subsidy. People in the lower tax bracket get the least subsidy. I would turn that around and have a refundable tax credit. That means people in the lower tax bracket get more, people in the higher brackets get less compared to where we are today. I would have the tax subsidy a refundable credit, meaning it doesn't matter whether you pay tax or not, you still get the money. And it goes to you instead of being attached to your job, because people change jobs a lot. I don't think we should have the tax subsidy for healthcare attached to your workplace anymore. We should attach it to the person. So if you lose your job, you still get your benefit. If you go self-employed, you still get your benefit. Now what I propose with Medicaid is to have that tax credit on top of your Medicaid, because I think you need to revive the Medicaid system, because there are a lot of physicians that won't even take it anymore. Now what we propose in this budget is to give the states the ability to customize their Medicaid to meet the needs of their particular citizens. States are begging for the ability to customize. They always go to Washington either to get waivers. Badger Care exists because people like myself and Tammy Baldwin and others, Democrats and Republicans, fought for a couple of years to get waivers from Medicaid so we can do Badger Care. We want to not have to go to Washington to get permission to do these kinds of reforms. We want to block grant the money back to the states so they can automatically have the right to do these things. Badger Care is what we use here. It's maybe not what they want to use in, New Mexico. So what we're trying to do is free up the states so they have the right, the ability to take that money and customize these programs so they work. Because the way Medicaid's working writ large across the country, it's not working very well. It's not keeping up with the times, it's not keeping up with inflation, but more importantly, it's done in such a way that a lot of physicians aren't even taking it. So I think you need to innovate the program, and we shouldn't sit in Washington and think that we know how to run this best for everybody in America. I don't believe that works.
Yeah, but there are way too many people who are uninsured currently.
Right.
How are we going to get those people insured?
Going to my first answer, I have a different opinion with the president. I really think his healthcare law is a big mistake. I don't think it's going to work. I think it's a fiscal house of cards. So what I've always proposed is refundable tax credits to everybody, which means cash, to go toward buying health insurance. What I also propose is take the people who have pre-existing conditions and subsidize their care. Literally subsidize their premiums so that if you get breast cancer, you don't go to the poorhouse because you got it. And if you do that, if you subsidize the people who have pre-existing conditions, which for the under 65 population is about 8% of our population, by subsidizing their care, they're getting the care they need, preventative medicine, disease management. You're also taking the risk they pose to insurance pools out,